Out of Liverpool, we have a major population growth that is continuing. We have new facilities, we have an excellent teaching program, and a large number of committed emergency physicians. I think anyone considering a career in emergency medicine should consider Liverpool.
I think Liverpool Hospital is a great place to start nursing at. We have a lot of education offered for the staff, and particularly for my ward, I'm a job share nurse unit manager, and that's a great opportunity for me to continue my role in management. And for our staff, we're very flexible on our ward, and there's a lot of opportunities, whether you're full-time or part-time, to be an employee here at the hospital.
People considering a career in health should consider Liverpool, as Liverpool is situated in a growth belt and there is a wide range of cultures, diverse people's backgrounds, and that brings together a challenging environment to work with interesting, exciting patients and conditions. The new facility offers an interventional radiology division which brings fantastic new equipment and the ability to perform state-of-the-art procedures unsurpassed in New South Wales.
I'm the cardiac technologist here at Liverpool Hospital. I've been working here for the last 18 months, and I was first attracted to come and work at Liverpool because I knew that it was a large hospital with lots of opportunities to see a variety of different patients from different backgrounds with different clinical presentations.
I'll tell you a little bit about the new area. We've moved into this new building, and how that impacts trauma is in a couple of ways. We have a couple of new high-speed trauma lifts which connect the emergency department and a couple of the hot floors in the hospital. So they only stop at certain floors. They'll stop at the helipad on the 7th floor. They'll also stop at the cardiac cath lab, the operating theaters and interventional operating suites, as well as the ICU on the 2nd floor, and then here on the ground floor for the emergency department. So that'll increase and improve the speed with which we can transport patients between these key critical areas, especially for time-sensitive conditions.
Podiatry is one of those professions where you can definitely integrate an allied health perspective but also a medical perspective, and specifically here at Liverpool, because we are working so closely with such a multidisciplinary team including staff specialists. I guess for me the biggest thing that I'll ever take away from being at Liverpool is the vast amount of information that I can learn off the other staff here.
You might consider working at Liverpool Hospital, and particularly training at Liverpool Hospital. As you know, Liverpool will be the biggest hospital in Sydney, and training in such a hospital where there will be jobs in the future may be a very good career move.
So I've been here at Liverpool for 13 years. Started off in the clinical information department as a relief clerk. I then worked up to be a senior clerk of the admissions department. I did a few secondments within the finance sections to learn about financial elections, the budget, and then I got the admissions manager position, which changed into the role it is now.
I've been nursing for 24 years, 17 of those have been in Liverpool Intensive Care Unit. The reason I've stayed in Liverpool Hospital is the variety of experiences I've been able to have and the roles that I've actually been able to work in. I've moved from working in surgical wards right up to nurse practitioner for intensive care, and have really been able to define and hone my skills.
You see all sorts of interesting cases here, some cases where other facilities, where some colleagues mention that it takes them years to see a particular type of case, where you might see this type of particular case monthly or even more often. So it's definitely an interesting area to work in, and it's probably known to be one of the more acute hospitals within the whole of Sydney.
I'm early on in my career, so being a part of a large tertiary hospital and working in a big department is really important for my career development and growth.